الحمد لله رب العالمين، والصلاة والسلام على أشرف المرسلين وعلى آله وصحبه أجمعين. Climate and Weather by Professor Mahmoud Hani Sulaiman. Introduction. Meteorology is science deals with study of changes or phenomena occurring in atmosphere. Components of meteorological environment are atmospheric pressure, air temperature, humidity, air movement, that is to say air velocity, direction and speed of wind, rainfall. Net effect of all these elements on health, animal life, and vegetable life for period of a month or year is called climate. With reference to a particular stated period or time, it is called weather. This world map shows the climate of the world distribution. It shows main climates, precipitation, and temperature distribution. Print and use for you to, when work in any place in the world or going to any place in the world, you would identify the climate and so know the effects of health. This is a very important map for world, shows climate change and modeled cereal grain yields to 2050. Increase in global temperature will make currently hot countries red get hotter, decrease their grain yield. Alternatively, current cold countries green will get warmer and so with increase in yield of their grain. This is from UNDP. This table is also very important. It shows by the year 2050 if the temperature increased by 1.5 degrees centigrade or 2 degrees centigrade, what would happen? If it increased by 1.5 degrees centigrade warming, this will lead to hotter months, decrease in clouds by 90%, increase in rain by 50%, wheat production will get down by 9%, maize production will get down by 3%, soy production will increase up to 6%, rice production will increase up 6%. The sea level rise will rise by 40 centimeters and 90% of reefs at risk at coral bleaching. If it increase 2 degrees centigrades, heat waves will become up to 1.5 months. Fresh water availability in the Mediterranean will decrease by 17%. Heavy rainfall will increase by 7%. Decrease in wheat production by 16%. Decrease maize production by 6%. Increase soy production up to 7%. Rice production will increase up to 6%. Sea level rise will be by 50 centimeters. Coral bleaching, 98% of reefs are at risk. Atmospheric pressure. Atmosphere envelope of air is about 320 kilometers thick. Air of lower level is much denser and heavier than air of the upper layer. Atmospheric pressure at sea level equal 760 millimeter mercury, called 1 atmosphere of pressure. Atmospheric pressure falls as altitude increase, as in high mountains, and increase as altitude decrease, as in deep mines. So at altitude of 100,000 feet above sea level, atmospheric pressure is less than 10 millimeter mercury, and for every 33 feet below sea level, atmospheric pressure increase at rate of 1 atmosphere. That is to say, when person descends 33 feet, as in mines, he is exposed to atmospheric pressure of 2 atmosphere, which equals 760 multiplied by 2 equal 1520 millimeter mercury. An instrument used to measure atmospheric pressure is called barometer. Effects on health. Influence of atmospheric pressure on health considered under 2 headings: effect of decreased atmospheric pressure and effects of increased atmospheric pressure. For details, see occupational medicine part. Here we will discuss it briefly. Effects of diminished atmospheric pressure occurs in high altitudes since air is less dense, temperature of air decrease, and partial pressure of oxygen decrease. Man cannot survive at altitude of 25,000 feet without breathing equipment. However, a human body has remarkable power of adjusting itself to low oxygen pressure if change is slow. Persons can live for long periods at heights of 15,000 to 20,000 feet without ill effects, but this adjustment of body is called acclimatization. The physiological changes at acclimatization are increase in rate and depth of respiration, increase in hemoglobin content of blood, increase in cardiac output. 3. Increase in rate and depth of respiration, hemoglobin, cardiac output. Effects of decreased atmospheric pressure. Continued sudden exposure to high altitude will lead to 10,000 feet will lead to acute mountain sickness or aviator sickness. Acute mountain sickness or aviator sickness due to rarity of atmosphere and oxygen. This will lead to headache, mental fatigue, irritability, irrational behavior, loss of muscular coordination, insomnia, nausea, vomiting, breathlessness, and in severe cases, bleeding from nose, ringing in ears, palpitation, and even collapse. Excessive secretion of lymph will lead to hemoconcentration. Later, chronic anoxemia due to decreased oxygen tension in blood. Chronic anoxemia. Later, as pulmonary edema develops, respiration is deep and irregular, the so-called kinestroke breathing. Oliguria, mental confusion, hallucinations, later develops stupor, convulsions, coma, and finally death. The only treatment is to carry that person to lower altitude as soon as possible. Effects of increased atmospheric pressure. As on decreased altitudes in mines and underwater sea, the atmospheric pressure will increase. In persons working in diving bells, caisson, etc., and symptoms are called caisson's disease, the disease of caisson. were exposed to high pressure of gas in air, oxygen, carbon dioxide, and nitrogen dissolved in blood and tissues depending on their partial pressure, and the whole body is saturated with air. Nitrogen exerts narcotic action. Nitrogen exerts narcotic action, which will lead to loss of mental function and consciousness. Increase of carbon dioxide enhances narcotic action of nitrogen. Finally, convulsions and death. When person comes up to surface, that is to say during decompression, process is reversed. Absorbed gas is released from blood and tissue. Oxygen retained and nitrogen liberated, which will lead to bubbles in tissues and gas emboli in blood vessels, air embolism, which will lead to fatality. Continued effects of increased atmospheric pressures. Workers do not suffer while in caisson, but grave symptoms occur after return to outside air. It is called decompression sickness, which is manifested by euphoria, sensation of increased interest, respiratory becomes deeper and quicker, heartbeats become stronger and slower. Then nasal voice disturbance in hearing, changed sense of smell or taste, rarely hemorrhages from mouth, tympanic cavity, and even from lungs. There may be perspiration with feeling of fatigue and weakness. Sudden decompression will lead to severe pain in muscles and joints of extremities, called bends. There may be vertigo, shocks, unconsciousness, or collapse. Pulmonary air embolism may lead to sudden death due to cardiac tamponade. Management of decompression sickness. On symptoms, when symptoms occur, treatment by recompression followed by gradual decompression. Recompression followed by gradual decompression. This decreases volume of bubbles in tissues and tends to make nitrogen diffuse from bubbles into tissues. Divers are instructed to come to surface slowly. Halden's method of graduated decompression or stage method provided beneficial results. To eliminate risk of nitrogen absorption among divers, helium gas mixture is used instead of ordinary air because helium is less soluble, has low saturation level, and higher rate of diffusion than nitrogen. Similar to decompression sickness may also occur when a person ascends rapidly from sea level to a very high altitude of about 25,000 feet. It is called dysbarism. Air temperature. Air temperature has direct impact on health of individual and has important effect on natural history of some diseases, especially vector-borne disease as malaria. For example, malaria parasites cease development in the stomach of female Anopheline mosquito when mean temperature is less than 16 degrees centigrade. Optimum air temperature for development of malaria parasite is between 20 to 30 degrees centigrades. Factors which influence temperature of air are latitude of place, altitude, direction of wind, proximity to sea. This is how air temperature is measured. It is for you to read. Please print and read. Air temperature is recorded by dry bulb thermometer and wet bulb thermometer. Please print this and read. These are the dry bulb and wet bulb temperature recording by dry bulb thermometer and wet bulb thermometer. And this is the globe thermometers, which is present for correction of radiation. Please print and read. Health hazards of air temperature. This can be studied under two heads: high temperature and low temperature. Here is the effects of high temperature. It is either local effect or general effects. Local effects: blackening of skin, prickly heat, which is heat rash or miliaria rubra, sunburn and dermatitis. Blackening of skin, heat rash or miliaria rubra, sunburn and dermatitis. General effects: heat exhaustion, heat cramps, and heat stroke. The pathophysiological effects of heat on body system is called heat strain. Heat exhaustion includes heat syncope, water depletion exhaustion, and salt depletion exhaustion. All this will be discussed in details in occupational medicine. Heat syncope: giddiness and fainting due to pooling of blood on lower limbs after prolonged standing in hot sun, which is common among many jobs. Due to pooling of blood in lower limbs, there will be decreased venous return to heart, and so decreased cardiac output, decreased blood pressure, and decreased blood to brain, which all these factors will lead to fainting. Practically, there is no rise in body temperature. No rise in body temperature during heat syncope. Treatment: patient lie in shade with head slightly down, so cerebral circulation improves. Patient recovers in minutes. Water depletion exhaustion: excessive loss of water due to profuse sweating. If water not replaced, this will lead to decrease of intracellular fluid, leading to increased thirst, oliguria, oligemic shock, and even death. Treatment by replacement of water. Salt depletion exhaustion: with perspiration, there is loss of sodium chloride, which will lead to decrease in extracellular fluid and signs of dehydration. Patient die of oligemic shock. Treatment by replacement by normal saline. Heat cramps: this is another acute clinical condition from exposure to heat. It is characterized by sudden and severe, painful, spasmodic contractions of skeletal muscles due to loss of sodium and chloride from body. Commonly occurs among those who are doing heavy muscular work in high temperature and are sweating profusely. Treatment by replacement of water with saline. Heat stroke: it is usually due to radiant heat from sun. It is very high body temperature above 106 Fahrenheit, rapid pulse, increased blood pressure, dry and hot skin, delirium, convulsions, partial or total unconsciousness, stupor, coma followed by death. Due to failure of heat regulating mechanism. Treatment is by rapid cooling of body. The details will be given in occupational medicine. Chloropromazine is recommended to prevent or to control convulsions. Prevention of effects of high temperature. Important. This slide is very important. A. Personal measures. B. Mechanical measures. Personal measures like replacement of salt and water, regulation of work, type of clothing, ventilation, protective devices. Protective devices as helmet, goggles, and shields. Ventilation must be proper in the working place. Types of clothing: minimum clothing. Clothing should be light, loose, and light color. Light, loose, and light color. 3 L's: light, loose, and light color. Regulation of work done by alternate period of work and rest. If symptoms of headache, giddiness, nausea, fatigue occurs, persons shifted from hot to cooler environment. Replacement of salt and water: additional 10 grams of salt daily and 1 liter of water per hour is required for an unacclimatized person. and it is better to be acclimatized with be given in occupational medicine. Mechanical measures: insulation, operation, exhaustion of hot air, replacement, circulation of cold water, air conditioning, painting outer surface of buildings. Insulation of the hot process where it is produced in excess. Operation of equipment from a long distance, exhaustion of hot air, replacement of hot air, circulation of cold water, air conditioning, painting outer surface of a building with aluminum paint to prevent absorption of radiant heat into the building. Effects of low temperature are either general effects and local effects. General effects and local effects. General effects: initially there will be shivering and tension of muscles leading to increased blood pressure and pulse rate, respiration rate increase, then decreased blood pressure, pulse rate, and respiratory rate. Later there will be hem concentration, oliguria, and muscular weakness with hypothermia at 80 degrees Fahrenheit, coma sets in at 75 degrees Fahrenheit, death occurs following ventricular fibrillation. Local effects: local changes occur in extremities, hands and feet. The conditions are acute transient inflammatory reaction. This is called hunting phenomena. Continued effects of low temperature: trench foot or immersion foot, frostbite. Please print and read. Treatment: the effects of low temperature. Rewarming of patient in water at 40 degrees centigrade. This is the most effective. Warming should last for at least 20 minutes. Vasodilators are not necessary because vessels are already dilated. Intake of hot fluids promotes general rewarming. Preventive measures: proper clothing with thick clothes, exercise, environmental heating, regulation of exposure to cold, adequate food supply because of increased metabolism in cold. Heat stress: characterized by an amount of heat that must be released or lost from body to maintain thermal equilibrium. Not lost. Factors influence heat stress are metabolic heat produced in body, M, heat lost or gained through convection, C, radiation, R, and evaporation, E. So S equals M plus C plus R minus E, which should be 0 if body is to remain in thermal equilibrium. Convection depends on air temperature and air velocity. Radiation depends on surface temperature of surroundings. Evaporation depends upon humidity and air movement. Indicators of heat strain equal heart rate, body temperature, and amount of sweat produced. Indicators of heat stress: equatorial comfort index, it is the temperature of air. Heat stress index, it is percent of heat storage capacity of individual. Heat stress interpretation: if it is 0, no thermal loss. 10 to 30, it is mild to moderate heat strain or stress. 40 to 60, severe. 70 to 90, very severe. 100, upper limit of heat tolerance. Humidity. Atmospheric humidity equal moisture content of air, which in turn depends on air temperature. The lower temperature of air will lead to higher humidity and vice versa. Temperature at which moisture precipitates, called dew point humidity, may be expressed as absolute humidity or relative humidity. Absolute humidity, it is actual amount of water vapor in an unit volume of air. It is expressed as grams per cubic meter of air. This is the picture of handheld dew point meter. Relative humidity RH is percentage of moisture present in air. Complete saturation being taken as 100. Greater relative humidity will lead to nearer the air to saturation. Even though humidity has no effect on health of individual, definitely it has an effect on comfort. If RH is greater than 65%, air feels sticky and uncomfortable. RH can be lowered by better ventilation. RH less than 30% over long period will lead to drying of nasal mucosa, predisposing for infection. Thus, it is also uncomfortable. So RH between 30 to 65% constitutes comfort zone of the worker in the working place. Measurement of humidity. The humidity of air can be measured by an instrument called hygrometer, of which there are two kinds, namely direct and indirect. Direct hygrometers are Daniel's hygrometer, Regnal hygrometers, Dines hygrometer. Indirect hygrometers are dry and wet bulb hygrometer, Sling psychrometer, and Assmann psychrometer. Comfort zone is a one where the worker in the industry feels comfortable while doing his work. The criteria of comfort zone are corrected effective temperature 77 to 80 degree Fahrenheit, relative humidity 30 to 65%, dry kata 6 and above, wet kata 20 and above, predicted for hour sweat rate 1 to 3 liters, average 2.5 liters. وأقول الحمد لله و thank you for your good listening.